communities in which lastly, I believe that representation is important. Okay, so first, why should we even really care about structure? So, a lot in this talk, I'll talk about structural racism just because we have a lot of work, academic work, research work, and even community work in this area. But I will also talk about how this opens us up to thinking about other types of structures, so other isms, and I'll say that a lot, so sexism and also homophobia. So, social determinants of health are kind of these non-medical factors, and they're associated with understanding the ways in which where people are born, live, work and play, worship, age, all influence health and well-being overall. We also know that one of the root causes of social determinants of health lie in structural racism and the other isms. So, structural racism can occur interconnectedly across multiple systems, physical and non-physical, so economic, educational, political, social, criminal, so on and so forth. And it's more about thinking about institutions and structures than thinking about the individual. So, structural racism is perpetuated by discriminatory policies and policies within institutions that compound inequalities between groups. And because of this, we can think about this as a fundamental cause. And being in public health, a lot of us are very familiar with fundamental causes. So, given like kind of the historical nature, there's many models of structural racism and structural isms overall. This is just one recently published that I kind of like. And this is really talking about structure from a more physical standpoint. And thinking about how it's a cause of a cause, we can see how structural discrimination is embedded in these different institutions. So, employment, neighborhood, education, healthcare, so on and so forth. And the ways in which it works is rather insidious, and where it really kind of compounds in these interesting ways to create disparities based on race and socioeconomic status, and contribute to differences in things like chronic disease and well-being. Right. So this is a more traditional model that really takes into account these more kind of physical aspects of structural discrimination. Okay. And so I tried to like pull out the pieces I really want you to focus on here. So in a recent Dean and Thorpe paper, which talks about the measurement of structural racism, they really kind of highlight the challenges in this field. And I just pulled out these kind of two pieces of measurement and interpretation. So in terms of measurement, we have this, kind of failure to capture the multidimensional and intersecting nature of structural racism and discrimination. So it is not only that there's structural racism, but there's also structural sexism, for example, who one of our speakers will talk about. But not only do these things not operate in silos, they actually interact. So one thing that we don't do enough of is thinking about how to measure intersectional structural isms. In addition, a lot of this research literature has been compiled based on structural racism among Black and Brown people. And we really haven't theorized or incorporated the experiences of other racial ethnic groups to a degree that can help us understand the ways in which structural racism and the other isms operate in these groups. And then just overall, we're always looking for better assessments to better understand and measure things like intersectional isms, structural isms. So it's not only the measurement, it's that we are in this time where the interpretation of structural isms has been quite diluted because of a mismatch between the question and the analysis technique. For example, the measurement of individual level factors can, in some cases, be a measurement of structure, but is not always. And we've seen a lot of studies that measure at the individual level and don't consider the role of self-report bias, for example. So how do we, choose these measures that really match our question so we can really advance the science and really get closer to prevention intervention um, overall? So now I'm going to give a little bit of an overview of measuring structural racism. I'll talk about other isms. And I just really want to be clear that there are many, many research papers related to measuring structural racism, and there's a long tradition in sociology. But I kind of like the organization of this particular paper, and that's why I'm going to talk a little bit more specifically about this paper. So there's three general approaches. So there's geographic, and a lot of us know this as neighborhood studies, right? So using census data and ACS data to kind of measure geographically structural racism or other isms. Number two is kind of this approach that can be useful, but it can be very problematic, and where we see kind of some erroneous interpretations because of the self-report nature. So it's about asking about people's environments and assessing structural racism and other isms based on people's self-report and survey measures. And then third, I really like this, and we see this a lot in anthropology and history and sociology, where they really look at this historical and contemporary policy analysis of the ways in which racist or sexist policies over time kind of influence behavior and individual behavior and population health. Okay, and so you can't see this, but the point of this is, and I will share the paper, is showing that in this review, we have several measures and metrics, and we can use a lot of traditional analytic techniques such as regression-based methods, mixed models, to understand structural racism, dependent on how the measures are implemented and how the question is asked. And in these approaches, we have the most on these kind of geographic area measures. We have far less in terms of these individual self-report metrics. And then again, the rich tradition in sociology and history, we have, approaches in this kind of historical and contemporary policy specific measures. And these are more like difference in terms of the analysis and hierarchical age period cohort models. So what is missing from this conversation? So I see a few things missing from this conversation. First is we focus on these three buckets that include kind of these geographical positioning, individual level metrics, and then these more kind of socio-historical metrics. But in these true traditional definitions of structure, norms and sentiment are a key part of them, right? But we don't see these, referenced in these kind of measures. So one of the things that I want to do is understand how we can incorporate, structural or measure structural racism and the other isms using these kind of norms and sentiments. In addition, we have to get closer to trying to understand the intersection between these structures because, again, they do not exist in silos. Um, Other limitations that we already know and are grappling with in terms of our area-based measures is that these areas are predetermined. And so the ways in which people move through these areas and the effect of these kind of, education policies in communities or neighborhood factors, the way they impact individual well-being and behavior could be varied depending on the ways in which people move through these areas. But because they're predetermined and bounded, we kind of miss some of that information. And then I already talked about the intersection. And then lastly, I won't talk about this a lot, but I wanted it to be incorporated somewhere on my slides because, I'm part of these groups at NIH and we're talking about it a lot. We're talking about structural resilience. So if we think about structural racism and sexism and homophobia, we have to think also about the ways in which there's these social protections or these kind of structural resilience features that we can really intervene on in terms of public health. Okay, so I'm going to now talk to you about some work that my colleagues, Dr. Chinara and myself, did to really address some of the limitations or some of what we think are kind of these missing pieces in the conversation around, structural racism or structural isms. And so in this piece, we looked very critically on the ways in which the online world impacted individual behavior. And the ways in which we did that were really based on this framework from Brenda Volpe. And basically, she was trying to outline the ways in which, the online world is a world and a structure in which has these different components that filter down to impact individuals. So there's this huge framework and there's a lot of moving pieces, but the key piece is the way that we measured, particularly in this study, is the way in which online racism and discrimination was related to mental health. And so, just in terms of a brief overview, research suggests that structural racism and/or homophobia is associated with mental well-being. However, structural discrimination measures relevant to these lived experience um, they kind of don't evade self-report bias. So there's a lot of self-report bias if you just ask people about what they're doing, depending on what your outcome is. And so we wanted to try to get kind of these objective measurements. And so social media and global positioning systems offer this opportunity to measure multiple types of discrimination linked to relevant locations via precise geocoding and activity spaces. So this is kind of going back to where I said, there's these bounded spaces and they're inflexible. We might be missing key information on how structures impact individual behavior. So with this particular methodology, we actually can link, activity spaces, so where people go, to kind of sentiment in that area. Um, and then for this particular endeavor, we know that, young sexual minority men of color may experience both racial and sexual minority discrimination and then subsequently poor mental health. So the aim of this study was to utilize social media as a proxy of local racial climate in an area, along with activities-based measures to generate exposures to race and sexual orientation-based structural racism based on spaces frequented. We then assess the relation between these two variables and mental well-being. So this was the P18 neighborhood study. Wow, this is so old now, but this is from a longer longitudinal cohort study of young sexual minority men and trying to understand risk and resilience over time. And this was a nested study, the neighborhood study. And so we um, followed men when they were about 25 to 26. The larger cohort study started when they were 19 years old, but the study was funded a little longer into the emerging adulthood period. And the total sample size was about 250 men. They wore GPS, the small quartz BTQ 1000 XT GPS devices for 30 days. And then we received information at 10-second intervals. Yes, 10-second intervals for 30 days. Um, and then the survey was administered that, was a correlate. It was administered only 2 times at the very beginning of the survey before they got their GPS, and then when they returned their GPS at the end of the 30-day period. And then we also controlled for neighborhood features, sociodemographics. And importantly, the days of poor mental health, the measurement variable, was in the last 30 days. So it made sense that they completed that survey at the end of the 30-day period. And then we asked them over the last 30 days, how many days of poor mental health did you experience? So it aligned with the GPS tracking. Um, so we use the tried and true, validated DPA method. We define the buffers at 50, 100, 200, 400. And then we used different versions of GIS to analyze the GPS data. Okay, so The socio-spatial self-organizing maps, which we used as our measure of structural racism and then structural homophobia, were created by this preliminary work by Dr. Rumi Chamarnara. And so the basic idea is that we collected all of the Twitter data from across New York City, so all of it. And Twitter data before the API shut down was attached to the GPS location data. And we were able to use a machine learning technique to basically train the process to know if there were more racist social media posts or less racist social media posts, more homophobic media posts versus less homophobic media posts in different kind of areas of New York City. And then we tied this to the GPS location of the young men in the study. So we created this measure of area weighted means for racism and then area weighted means for homophobia. And then of course we had to normalize it to 0.1 or it would have just, the measure would have been out of control. So basically, if you spend more time in a more racist place, as defined by, the social media data in that area, then you scored higher on the measure. And the same thing for homophobia. Okay. So overall, the sample, they were really at the end of their emerging adulthood period. Emerging adulthood is 18 to 29. Most of the sample identified as gay, a few identified as bisexual. We had an equal distribution of income, maybe because some of them were still in school. And we worked really, really hard to get a diverse group of young men. So we saw 0 to 14, 15,000, all the way up to 35 plus thousand. And then that was our one measure of structural racism and homophobia. And then we did a zero inflated Poisson model to account for the over dispersion of the zero values of the study outcome variable. So days of poor mental health, it was zero inflated. We did so much modeling, a lot of sensitivity analysis. And we also found that out of the quadratic and the linear function, the cubic function was a best fit for the data for structural racism and structural homophobia. And so after determining the correct model fit, we did interaction terms between the structural racism and structural homophobia variables, basically to understand the differences between the different racial ethnic groups. And then the post hoc tests are where we did all of the simple slope analysis, so on and so forth. So it was statistically significant. Hispanics, not in the same way, not in the way we thought. And homophobia was not statistically significant in the model. So what does this look like? All right, so.
I'm sorry, could you just tell us the research question one more time? This is the amount of time you spend in neighborhoods that are higher structural racism is correlated with number of days. So you're predicting number of days using, just what association got tested? I got a little lost.
No, that's okay. So at the end of the study, at the end of the 30 days, we did a survey. And in the survey, you had to report on number of days of poor mental health.
Yeah.
So that was the outcome measure. And then the IV was area weighted structural racism or area weighted homophobia.
I see. Okay, two features, one outcome.
Yes,
okay.
yes. But homophobia we won't talk about because it wasn't statistically significant.
Okay.
Right, and so interestingly enough, and I have lots of thoughts about why I think so. Will they still be able to hear me, Danielle, if I walk over there?
Yeah.
Okay. Sorry you can't see. So on the graphic right here, this is our area weighted mean of exposure of race-based discrimination, and these are our different racial ethnic groups. And what you'll see is basically when we look at the white group, there's really nothing going on. So if you spend more time in a racist area, there's like a slight increase in terms of numbers of days of poor mental health, but there's not really anything going on. What you see in the Black group, Black young sexual minority men, is kind of what we expect to see. So the more days that you spend in, the more time you spend in these um, uh, uh, racist area, you see more days of poor mental health, right? We do see something that, there seems to be kind of this cut point where, you know, after you spend a lot of time, then you have really bad mental health for young Black sexual minority men, which is really interesting. And some qualitative work would have really helped us kind of figure out why that is. Interestingly enough, with the Hispanic men, we found this really interesting but statistically significant trend where we see that there's like a slight rise when you spend less time, but then when you spend more time, it just kind of peters out and then there's nothing going on. So, meaning that you're spending more time, but then you're not experiencing more days of mental health. It just like hovers around zero. So this could be an artifact of the data. We had a lot of variability in that category, or there could be some kind of habituation effect going on. But we couldn't figure out why we saw that habituation with Hispanic young sexual minority men and not with Black young sexual minority men, right? So I think that this study actually brought more questions than answers. Adolfo?
Do you want questions now or?
After, please. I know there's a lot of questions. I'm almost done. I left a lot of room for. But this was the inputs. Okay, so just let me summarize really quickly. So overall, spending more time in these like structurally discriminatory spaces was associated with more mental health. Hispanic men, we found kind of this thing where we saw this initial increase, but then there was kind of this decrease to kind of nothing going on. And then for Black and white young sexual minority men, there seemed to be kind of this steeper increase over time. And so one thing we argued in this paper is that it might have been kind of this habituation effect, or there might have been some, unmeasured variables going on, or some level of resilience that we really need to take a look at that we just didn't in this study that can kind of account for those results. But what it did was provide the preliminary data for us to actually answer these questions. So right now, Dr. Chinar and I have an R01 on social media, cardiometabolic health behaviors, and social protections among sexual and gender minorities. And in this study, we're actually able to look a little bit further at, number one, what is going on with this Hispanic group. We have a bigger sample size. And look at different outcomes. So this study is about cardiometabolic health behaviors. So understanding poor sleep, physical inactivity, alcohol and tobacco use among a diverse group of sexual and gender minorities. In the previous study, we only looked at sexual minority men. In this study, we are looking at gender minority and sexual minority individuals from across different racial ethnic groups. And then we're also able to look at this kind of structural resilience, which I talked about a little bit before, and have a whole presentation on, but we'll not talk about that today, where we need to really understand what are these structural social protections that we can intervene on in terms of public health practitioners and public health researchers. And most importantly, we go deeper in terms of methodological and statistical development in terms of trying to explore the interactive effect of social protections and individual level protections on the association between structural level discrimination and harmful CHBs in this population. And this is really big, but this is what I just wanted to bring home with this is that the framework and the mechanisms are complicated. So when you think about minority stress and you think about structural discrimination or structural racism or the isms, you can't only think about them in a silo. You have to think about the ways in which individual and interpersonal level of discrimination may, impact these structural levels. And so here we have both the proximal and the distal level measurements of discrimination or minority stress, and also the proximal and the distal, so the structural and the individual and interpersonal levels of the social protections or resilience features. And then we have several primary and secondary outcomes. So I dropped a lot on you, but just to try to summarize a little bit, methods for measuring structural isms have come a very long way. So one thing I don't want to do is poo-poo on all of the very hard work that's been done to this point, because it has created so much policy change, so much excitement about really trying to address issues related to vulnerability. But I do think that we need to think more critically about accuracy and precision. And in that need, I do think that we need additional measurement techniques like these machine learning, but we also need to think more critically about the introduction of new structures across time. So I'm not going to tell you how old I am, but like, I remember the internet when the internet was not a thing, right? And so how do we think about the incorporation of the online world and the pervasiveness of it, especially among young people, when we're thinking about the structural isms? And how do we incorporate that not only into our pedagogy and theory, but into our measurement and increasing the complexity, but also being able to measure and address that complexity with new methods? Um, and then, there's institutional racism, cultural racism, structural racism. And what I've learned through this, process and like a lot of the work I've done in this area is that one of the key features to all of these structural and ism, like basically area-based features, is norms and sentiment. So I actually think that we need to think more critically about measuring these norm and sentiments when we're thinking about even the geo-related area metrics alone or neighborhood studies, because it's really important to understanding kind of this hegemonic process in which the norms and sentiments are infused within communities and within populations and influence health and well-being. And when we're trying to understand the isms, I think there's a few things we need to do. We need to utilize innovative methods to more precisely measure the impact of structural isms, like what I presented today with the integration of the space, the socio-spatial self-organizing maps and activity spaces. I think about, we need to think about the modifiable structural resilience factors and think about how we integrate them into our work, because we really want to focus on modifiable structural resilience and social protections, especially in public health. And then I think that one thing that we haven't done so great at is really exploring the interactive effect of social protections or structural resilience and the individual level protections on the association of these place-based discrimination and harmful CHBs or whatever outcome you're interested in. So for example, like in neighborhood studies, we have these metrics to measure, neighborhood structural racism and, general mental health. But, I think that misses the complexity of the experiences of individuals and how they live and walk through that neighborhood and the experiences they have in that neighborhood. And we might be able to capture resilient features or advanced science by really knowing and understanding those particular more granular features of the ways in which kind of structural isms influence human behavior. And with that, our two colleagues that are coming on November 14th and December 12th really will pick up and expand on some of the challenges that I talked about just now. Dr. Esser is really good at thinking critically about innovative metrics and measures for kind of understanding and measuring structure. And then Dr. Patricia Holman is really good at thinking about these other structures that we need to think about. So structures of sexism, and what's really unique to her work is thinking about how structural sexism, for example, doesn't only affect women, but just affects everyone and kind of how that happens, and then the measures she uses to try to understand how this happens. So references, my lab, Thank you guys for coming. And now I'll take questions. Thank you. Minutes. I did well. Okay. Adolfo, do you want to wait, let a student go first? Okay, so does the student want to go first?
So we're gonna take questions in the room, but also for everyone on Zoom, if you do have any questions, just feel free to drop the questions in the chat box or raise your hand, and then I'll make sure to kind of allot some time, so that way we can also take questions from Zoom.
Thank you. I saw student hands. No, you're not, okay.
I was really interested in how the data map that used the Twitter data, did the data differentiate between like what tweets were being racist to what group, or did it just aggregate everything into just racist?
Yeah, so we did that first. That was really hard, cause like, that was actually really hard because like, how do I say that? Like, I feel like I felt like I knew current vernacular, but we had to, hire a slew of young people to help us understand, the vernacular. But no, so in the machine learning process, we make sure to, uh, uh, delineate to whom, because that was really important. So for example, was the N-word to another, from a Black person to a Black person, was that meant to be derogatory, or was that like some other kind of meaning? Because if it was, then we couldn't use that, right? So we had to do that granular work first before we aggregated up. But then we did eventually have to aggregate up, and we had two forms of discrimination, targeted and self-narration. So targeted was where someone posted on someone else's Twitter feed something racist or homophobic, and then self-narration is when they posted it on their own feed. Yeah,
Thank you.
no problem. Brent, oh, well, Adolfo, because I took one student and then professor.
Actually, really quick question, actually twofold question, because one just came up right now. So actually going here, you mentioned something interesting about habituation for Hispanic participants. I wonder if also what might be playing a role here is just that Hispanic participants have an easier way of navigating these areas quite a bit. Like obviously, race might be playing a role here, that they're able to kind of see the world around them, and then also recognize that they may have some privilege to kind of navigate the system. And I'm wondering if there's going to be like a follow-up qualitative study to just kind of capture this phenomenon.
That's interesting. I feel as if that's really interesting, actually. So in the social media grant, we are going to do hopefully some qualitative work. I think what happened here is that we had to aggregate all Hispanics, so that's like Black, like, and like the Hispanic groups, sometimes they just identified as Hispanic and they didn't tell us their race. So I think that like we're just seeing like like lots of like variability in the category. But now that you talk about it, I think that that's an interesting question that we should ask. So like yeah, I'm just thinking about how to measure that, or is that a qualitative endeavor? But that's really interesting. That's really interesting. Sorry, now I'm just thinking about it. Go ahead.
Now the second question is, you didn't find an association between homophobia.
Yeah.
Like, why is that?
I have no idea. We like, I did the data analysis, like I looked at it every way and I'm just like, what is happening? And I think what it comes down to is that racism is so pervasive and we become sensitive to it in a way in which some people, I don't know, can mask or move through the world and not experience the same repercussion based on homophobia. That's the only thing I can come up with. But again, that we need more qualitative, data to really understand what happened there. But there was nothing. Yeah.
That also reminds me of one of the recent incidents where I think it's like when we talk about racism, we also don't think too much about it's like a racism against whom, so that the regions are perpetuated by racism against whom. Because like just using my personal experience that I was on Broadway, someone said a slur against Chinese to me, and I was like, oh, I'm gonna tell him that's wrong. And then there's so many other people going by just criticizing me for making a scene.
Yeah.
Because I feel I can also imagine if I have said the N word, that's gonna, the reaction will be so much different because people's awareness of what constitutes as racism is so different. And I feel like, unfortunately, in the United States, like when you said some certain words against African Americans, that's probably where the regions you would have a better detection of where racism is happening.
Yeah.
Versus for some other sentiment that might not, for example, for Hispanics, maybe it wasn't really fully captured in a way, so that I think the data might react more with that
More sensitive, yeah.
more sensitive to Black versus other races. And I also thinking like, especially for the regions, if that person said the same word, for example, in Queens, in Flushing, the reaction would also be so different. So I feel like it's the same word, same level of discrimination, but because it happened in different regions of different communities, then the sentiment will be so different. So I feel like, unfortunately, from like social media data, many of those might not be fully captured because we don't. It's like, oh, we try to understand is whom discriminating whom, but then like if you're doing this like a social geographic from social media data, then that a lot of those were potentially missing.
Well, that's why this was very particular to young sexual minority men of color. Like, we didn't do the study on Gen Pop, so like it's not only awareness, it's like norms around racism too. So like it might be more normative in accepting to be racist to groups outside of those who are Black and Hispanic, for example, which isn't right, but the norms created around that might mean that the reaction and the internalization is different. But that's why you have to be, and that's why I keep on saying you have to be particular about your population too. So for example, we didn't have any Asian, like we have very few Asian men in our population. It was mostly like Black and Hispanic men. And so this study was very particular to Black and Hispanic sexual minority men. And we did that on purpose because of exactly what you're saying, right? So if you're in an area with higher sentiment, but there's differences in the way in which people are praising that sentiment or interacting with that sentiment, then you'll get vastly different answers, like across areas and locations. And so that's a really good point because it's a measurement point. And that's what we're talking about when we want to get more specific and granular in our measurement. And it really starts with the specification of our question, which obviously is also difficult because public health is about population health, right? So, there's also some pushback about being that specific because of the issues you raise. Yeah. Okay, Saba, then Brennan, then what's your name? Krishika, yes, I know.
Thank you. This is a really great talk. But I wanted to, no, I mean, as everyone knows, it was great. I wanted to build off of your question because I had a similar question. So if your data like lets you partition the exposure into racism towards different subgroups, have you looked at it doesn't?
No, we haven't done it because the
Okay.
sample size was really small, but we will hopefully do it in my current R1.
So could you but I mean, the sample of the tweets is really high, right? So could you look at who are the tweets targeting? Is the Venn diagram of racism towards different subgroups, towards Asians, towards, Hispanics, whatever, is the Venn diagram all perfect? Or they're just people who are racist against everyone? Or I imagine there's gonna be a more complex map there of areas where racism towards certain groups are higher, areas where there is overlap, areas where there's a lot of racism between minoritized groups, towards each other, who is,
Yeah.
So I'm just wondering, to give you more work.
So to be fair, we have so much data that's just sitting there waiting to be analyzed. So I'm Saba, if you want to do diagrams, we have, so much data, and we would love questions like that answered. Because we really do have the data. We have all the data. We just,
And I think that Twitter data is like, it scares me how big it is, but it is an interesting source. I mean, it's a very uncomfortable, as you just said in your answer to Lindsay's question, it's a very uncomfortable and unfortunate topic, but there's also, I think, a lot of like racial hostility between different minoritized groups that we
Yeah.
haven't fully figured out measurement-wise, public health effects-wise, like how to deal with and look at. So something that
I believe you. No, you're exactly right. And so, we have this paper on, I hate when I have to talk about my papers and like dig them from the back of my mind. Okay, we have this paper using this Twitter data with self-narration and targeted racism, and looking at correlations with hate crimes across 100 cities across the United States. And so with that paper, we get at some of what you're talking about. So the regions that have more hate crimes versus less, and how is that correlated with discrimination, and are stereotypes about certain regions of the country more true? But what's interesting about that is like, learning about how, there's different words for like different populations that are racist depending on what part of the country you're in. That was really hard. But doing all that, work, we have this really rich data set. So we can nail down some more of these questions.
First off, this was just absolutely fantastic. Like, I remember being in like SMS before and the beginnings of this work. Like, you were absolutely amazing. This is fantastic.
Oh,
You used
I'm taking
hegemonic
her
words,
everywhere.
like y'all don't even understand. Like, she went in on SMS as well as what has gotten so grown in a way that is just beautiful to get the word out about what is happening amongst very groups that need to be supported. And I thank you for your work. I was just wondering, does the machine learning differentiate between like if there's like one super racist like user, or if there's like it just aggregates all of the discriminatory like
We had hundreds of thousands of media posts. So just like as a data people that are data people, you just have to at some point aggregate, just like the GPS
Yeah.
things. We have data every 10 seconds for 30 days. So at some point you have to aggregate, but like we can always like we have disaggregated data. So I think that those are,
but I'm just saying,
can
like, what if
ask.
there's like 10
yeah.
really racist people in this one like apartment building? Would that then mean that
Then we
that
take
area
the
would be-
average. If there's like, 400,000 tweets in that area and one person has 20 or 100, then.
So there is something to like,
Oh yeah, we have to average across areas because that kind of couldn't work, yeah. No, but that's a good question, like basically the weighting. Did we wait? No, we didn't. So- No, you can't ask me a question. I'm playing, yeah, I'm playing, Alex. No, I'm playing.
Saw you at the Intersectionality Institute, love your work.
Thank you.
And I wanted to ask a question around the norms and sentiment part that you were talking about. As a social work student who's more qualitatively inclined, I'm always trying to think of how do you, I guess, like with norms and sentiment, do you think of also like figuring out ways to quantify political intent or like policy intent? I try to do it qualitatively to like chart historically how policy has changed, but I struggle to quantify it and then make it into like a measure that
Yeah.
analyzes impact. And then when you talked about like hegemony, I'm also kind of like, how do you quantify hegemony? If there's work already done, if you're thinking about it, or like if you have ideas.
I think that the way I think about Foucault and hegemony is that like it's an organizing framework, and I love sociologists and I wish that I could just like live with them for a long time. But like I feel like my job is to think about how to operationalize organizing framework. And so you shouldn't think about hegemony as like something to measure. Instead, you should think about how it impacts all of these measurable things. So when you talk about like, political discourses and the change, is it discourse? No. Political, like changing climate, I think that I would love to have a student create a data set of that over time. Because once you create this data set, you are able to basically then, measure things. And so, for example, we have an election study, my team over there are wonderful, and I do stress physiology work, and so we're about to go to the field the last time for our stress physiology study, and one of the key things is tracking like historical and political shifts over the study period. So for the last 3 months, we have a spreadsheet of, when the Hamas leader was killed, like, there were these were the things going, Eric Adams being indicted, right? So because we're interested in the ways in which these political shifts also impact sociopolitical stress, from a qualitative standpoint, but also physiologically. So, yeah, and we could talk more. Alex, okay, let's do the hard one. Come
Oh,
on.
no.
Like,
Oh.
5 minutes. Okay. Do we have anything online?
No.
Okay.
I mean, so one aspect of your weighted exposure metric is if I were to spend twice as much time in a neighborhood that's half as racist, that counts the same. Or like if I live and work in a place that's 50% racist, or if I just live in a place that's 100% racist and work in a place that's 0%, those would end up with the same value on the x-axis.
Right.
So I know you had to make a decision. I'm just wondering, did you interrogate that? Yeah, like how?
Yeah, we talk about it in the limitation section, but then there's this whole literature in the neighborhood literature about really people kind of spend time in the same places and don't really leave. And so one of the sensitivity analyses we did is really trying to understand what is the percentage that people are really like, spending time in these different areas. And it wasn't great. I don't know what it is. I can get you those numbers. It wasn't great. So we did do sensitivity analyses around that. And the one thing that, all of us statisticians struggle with is like this regression to the mean or this averaging out. So we did do some work around that. And I think we did mention it in the limitation section of the paper. And I just really also want to highly stress this was such a small sample. The sample that we're going into the field with now is 450. This was much, much smaller. And so we hopefully will have a little bit more leeway to interrogate more of these specific questions that people have. I'm surprised no one asked about other racial ethnic groups. Now we have all of that info. Now we will be inclusive of different groups in a way that we just weren't able to with this original analysis.
That actually goes into a question I wasn't gonna ask, but I had. So actually the question was about whether or not you plan to expand into other racial groups outside of white, Black, Hispanic, and then of course, maybe compare their experience of race-based discrimination against all of that.
I don't like comparing.
Not necessarily comparing, but there is socially, I guess, this debate, right, around the Black experience does differ from other experiences, right? So the race-based experiences that maybe the Asian population experiences, or maybe Middle Eastern or Southeast Asian populations may experience, may be very different, right? But still very much race-based discrimination that really shows a great difference between if you are of that ethnicity or if you are white, right? And also whether or not you identify as Hispanic or not, right? You have white Hispanics, Black Hispanics, who also will experience different who will experience race-based discrimination in different ways as well, even though they both identify kind of as both Hispanic, but because of the color of their skin, they face different things. Yeah. So not necessarily comparing, but being able to really see racially how each of these groups are experiencing it, and the scale of how bad it is based off of race especially when it comes to kind of where we live demographically.
Yeah, no, I think that's really important. Did you want to answer a question?
I just wanted to add, and don't forget about us mixed folk.
Okay.
Yes,
Girl,
in the
let me
mixed
tell you,
folk.
let me tell you. And IH didn't want us to forget either, and I was like, no. No. I shouldn't be flippant. So I believe, based on my work so far, and the rich sociological and social psychology work, is that, the ways in which structural isms work in terms of norms and sentiments is there is variability in the ways in which they're infused into our population, and that this triggers different experiences by different groups of people. As a public health practitioner, I am less interested in comparing across groups to say one is more or one is less. But I am very interested in the experiences of young sexual minority South Asian men, for example. So I can particularly intervene with prevention programming and interventions for that group. But this being an NIH grant and this being the world we're in, some comparisons tend to be natural. So some of that might happen, but I basically designed this study so that we have quota sampling of the different intersecting groups so that, no one will go invisible, that we will have a better understanding of these populations that we have not really understood in terms of the structural isms previously.
It's also 12 o'clock. So-
Oh, sorry, one more. You've been raising your hands for 20 minutes. Just one more question, and then I will stay after and people can ask me questions. Yeah.
Thank you. I have another Twitter data related question. I was wondering if your team differentiated between accounts that like posted as themselves as opposed to posting as some anonymity. No? I just feel like it'd be very interesting because I feel like I've experienced a lot of people who are like very vehemently racist online, but that doesn't
Yeah, but they
express
don't
in
post
their-
under there. Yeah.
Yeah.
I don't know. That's a really good question. Maybe I could look at the data. I don't even know how you figure out if they posted as someone else. So that's something we can look into. That's why we need more young people to come. Thank you so much, everyone. I'll stay after.